If you're a patient or will be a patient between now and end of June, there's a likelihood that you will not receive medicine from a government hospital, the already existing shortage of drugs in some facilities notwithstanding. And here's why. In April last year, Parliament approved a $200 million loan, approximately 714 billion Ugandan shillings, towards funding foreign exchange expenditures as they arise.
As the National Medical Stores, we expect money from finance, which is supposed to help us bridge a gap which was caused by the depreciation of the shilling. And
one of the beneficiaries was National Medical Stores, or NMS, under the Ministry of Health, which wants to receive $42 million, about 150 billion Ugandan shillings, according to documents NTV has seen. The documents further indicate that this money was subsequently released by the Eastern and Southern African Trade and Development Bank, or PTA, to the government of Uganda through Ministry of Finance. However, NMS says they have not received this money 6 months after the money was released.
An equivalent budget of various center tools, 3s and 4s, would be used up. So we will have no money in essence to buy them medicines. They will only be able to get, for example, antimalarials and TBs and ARVs, because those ones, their money is ring-fenced. But the rest of medicines and medical supplies, including gloves, not even cotton, not even syringes, they will not get, because the money will be used to cover up for the debt in the previous year.
Yeah, the Permanent Secretary in the Ministry of Finance, Keith Muhakanizi, wrote to the General Manager of National Medical Stores, Moses Kamavare, committing himself to paying the 68 billion shillings on condition that NMS must provide evidence of the financing gap arising from the depreciation of the shilling. And yet, NMS alleges that even when all that was done, the Ministry of Finance has still failed to honor its commitment.
We submitted the documents, both finance, to the bank and defended it at Parliament level together with the Ministry of Finance. And the loan was approved, and we're saying, why can't you help us and advance this money so that we settle this?
The issue was brought to the attention of Parliament on Thursday by Dokolo MP Cecilia Gual.
Something which will make you even feel more upset is that if you look at the budget of this year, of the year coming, 2017-2018, a provision of money for repayment of that loan has been made in that budget, and it takes 44% of the budget for repayment of loan. 44%. So that shows how expensive it is. Now, having spent all that much money and knowing very well that we have even started repaying that loan, but the emergency areas have not been, have not seen that money.
I am more than happy to have an audit for those who challenge us, because they're talking about, I don't know what has, maybe it's because the growth is lower this year, the amount of rumor mongering I can't understand. That $20 million is lost. If anybody challenges me, check, audit where this money has gone, and has gone to consolidated account. And so, to that effect, as per last week, we had received about $72 million, and it's all went to consolidated account.
Finance has now asked NMS to buy purchases on credit to mitigate the lack of supplies. However, it is an offense under the Public Finance Management Act to commit funds that are not available. This dilemma leaves the Ministry of Health in a difficult situation at a time when some districts are facing drug stockouts.
We presented a need. We substantiated a need. We defended a need with a document. The need was confirmed indeed to be a need, and the PSST himself confirmed to us in writing that they recognize the need and they will take care of the need in the financial year 2016-2017, first quarter, that they will give us the money. So, when did it cease to be a need?
As Parliament queries whether and why this money was diverted without its approval, many patients, particularly those already living on the margins, face tough times ahead. Shillings, NTV.